Hi, my name is Dr. Sherry Kosman, and I'm a licensed clinical psychologist, and I'm Behavioral Health Director at New Horizon Family Health Services in Greenville, South Carolina. May is Mental Health Awareness Month, and today for Mental Health Monday, I'll be discussing briefly mental illness and co-occurring substance abuse disorders. According to the National Institute on Drug Abuse and the National Institute on Mental Health, many people who have a mental illness also have a co-occurring substance abuse disorder. In fact, according to many national surveys, up to 50% of people who have a mental illness also have a co-occurring substance use disorder. Although the national surveys are limited on adolescents, the research that we do have indicates that up to 60% of adolescents who are currently in treatment for substance abuse in a community program also meet the criteria for a mental illness. Some of the more common mental disorders that you might see would be anxiety, depression, post-traumatic stress disorder, bipolar disorder, psychotic disorders like schizophrenia. And some of the substance abuse disorders you might see would be alcohol abuse or dependence, cocaine or crack abuse and dependence, nicotine dependence and abuse, and also, and we can't forget, opioid dependence and abuse. Research suggests that there are several reasons why mental illness and substance abuse might be co-occurring. First, mental illness and substance abuse tends to run in families. This would suggest that there's a genetic component to co-occurring disorders and that some people might be more at risk. Secondly, many people start to use drugs to manage emotional or physical pain. Now, we know what physical pain might be from an illness, but emotional pain comes from several different sources. It can come from trauma, sexual, verbal abuse. It can come from living in poverty, discrimination, homelessness, bullying. There are several factors that can contribute to emotional abuse that can lead to drug abuse. In addition, the more we use a drug, the more our brain desires that drug. We develop tolerance, and eventually, people will need more of that drug just to avoid withdrawal, and that's called dependence. Thirdly, drug abuse can contribute to mental illness by altering the neurotransmitters in your brain. Every time you use a drug, your neurotransmitters in the reward center of the brain get altered in some fashion. This can lead to depression, anxiety, mood swings, and even loss of cognition. In addition, mental illness and substance abuse can impact physical health and can exacerbate existing medical conditions. This is why an integrated team approach to substance abuse and mental illness when they're co-occurring is extremely important. At New Horizon Family Health Services, we have an integrated team of providers that consists of physicians, nurse practitioners, physician assistants, behavioral health clinicians that can help you. Make an appointment with one of our primary care providers, and they will either refer you to one of our behavioral health clinicians or a substance abuse treatment program to get help. Just remember, you are never alone.